Welcome. Could you please tell me who you are and why you're here?
I'm Mark Kramer. I'm here sort of representing Razorfish Healthware. So Razorfish Healthware is committed to improving healthcare, and we want to know from all aspects of life. So how is the quantified self movement part of the solution in the sense of how to improve health amongst individuals and also in our communities? So I'm here basically showing our support, but also learning about different products and services and the different methods and the research that's currently going on.
Yeah, because you formulate it as if it's still a question. Is quantified self or can it be helpful?
Yeah, I think people being aware or actually tracking their life, tracking aspects of their life, whether it be nutrition or activities, can help give a broader picture of an individual. So I mean, health is not something passive, something active. So personally, I have only started tracking in a formal quantified self healthware type of tracking the past 2 years. But
So what do you track?
well, currently it is tracking nutrition and movement and sleep. But
And
then
what has it learned? What has it learned you?
what has it taught me? It has, well, actually, the last 2 years of my life, I've been experiencing a very challenging medical issue. So it helped motivate me through that. And so that was one of the reasons I started.
Yeah.
But I think
You were ill and then you started tracking.
yeah, during my illness, I started tracking my nutrition, and then it just went further. But then I saw the power of how just knowing that you're keeping track of aspects is a motivating factor, and being able to share that actually is probably the key element. By having family, friends, or other individuals kind of encourage you or be part of that process, can be beneficial within a healthcare context. But when I said I've been tracking the past 2 years, but I mean I've been live blogging the past 10 years or so, photos, videos, or tracking my movements, and that was a habit of mine. And I probably have all the payment stubs and receipts somehow digitized of all of my financial transactions. So I think people have been quantifying themselves, whether it's financially or knowing where they've traveled. They might collect their tickets for travel or trains or planes or whatever. So people quantify in general. I think the quantified self has identified itself a lot in healthcare because there's a lot of untapped potential. And we have a lot of amazing portable and ubiquitous and pervasive technologies currently, which allow us to look at health and health issues differently. And this is what's fascinating.
Yeah. So what's the potential we don't use at the moment?
One thing, I actually was in an interview a little bit earlier. The last question in that interview was like, if you were to say something to the quantified self community, what would you share? And I think the quantified self movement seems to be mostly in developed and Western-oriented cultures currently.
Yeah.
But imagine if we were able to help track in lesser developed regions where healthcare systems are not as developed or not as embedded, or healthcare is not widely distributed.
Not available.
Or not available. I think it's possible that quantified self methods as well as tools supporting these sort of tracking ecosystems could actually help us gain a much different insight into health in lesser developed areas. We might find that people are actually more healthier than they are, or they're more resilient, or they've adapted to challenges different than we have. So I think it would be fascinating to somehow make it a human right that if I want to track something about me, that I'm able to do that. If that data makes a positive impact on society. So maybe in the future, quantified self behaviors might become a everyday part of life.
Is it for everyone?
I guess there's two ways to answer that. If you look at, let's say, the concept of ubiquitous computing, where it should be in the background and sort of silence, where it's just tracking without you knowing, then it's a matter of me just allowing myself or my habits or behaviors to be tracked.
Yeah.
So it's not something that I have to really think about. But if you have a device where it's battery operated and you have to charge it every day, or you have to kind of maintain it, or
You have to log things
yourself, then it's a little probably, I don't want to say it's more difficult, but it's less motivating, or you have to put in more effort. Mm-hmm. And so then
less people will do it.
Yeah, I notice people or friends in which we're following each other in our own tracking. You notice that they might not be doing something for 2 weeks. So, and you can understand why. Maybe they forgot it, or they just
don't care anymore.
Yeah. If it's a part of you, if it's embedded in your clothes, or it's
in your skin,
something. No, that's a good question. I don't know if I'd want something in my body, but something that's a piece of jewelry that's much easier to worry about.
So how do you see the future for quantified self? Is it well, it's going to grow, of course.
Well, what my impression is that the individuals who are here are mostly sort of trailblazers or pioneers who want to push the edge, push the envelope, and see, okay, what can we do? What are the use cases? So developing methods and use cases, and discovering new areas that we track, or improving the areas we're tracking currently. So, of course, there's a future, but hopefully the future is that people don't have to call themselves quantified selfers. Mm-hmm. It's just a part of our everyday habits and behavior.
Mm-hmm. Is it an answer to everything? Aren't there just I can see that areas like weight or movement or food and maybe sleep, that it really works very well there. But you also see behind us, for example, about
cardiac monitors,
things like that. What will it tell? What things like that tell us?
Well, it's very broad, and then when you measure or capture items singularly, maybe that doesn't tell you so much. Mm-hmm. But what's interesting is when you take data from different individuals in different contexts. So, let's say hypothetically, the urinals in all the toilets have sensors to kind of track the urine. It's anonymous, of course, but they can see. They did an experiment in Italy where, in a soccer stadium, they were able to kind of measure what kind of drugs were being taken in that city. Yeah. And because they knew through the urine that cocaine usage is high in the city at this time, or during this football game, maybe alcohol levels are higher. So if you take, let's say, public issue data, public health data, so if you have sensors which kind of log anonymously things going on, you can say, okay, in Amsterdam, obviously they have a higher concentration of certain drug usage because they have the sensors to measure that. Yeah. And you take that data and couple it with individual data, like even though there might be high drug usage here, but actually people are living healthier lifestyles because you're tracking the nutrition or you're tracking other aspects. So then you look at Amsterdam, then you compare it to, say, like another city, which is similar, but maybe they don't have this healthier lifestyle. Then maybe you discover differences in habits which affect public health of individuals.
But what would you do with that? Because do you use those data to to change behavior or to push people to do certain
it could be,
things?
or to develop policies. So if a city is trying to say, we say the pollution levels are high, so they have pollution data, but then if people are tracking and the health of the people is actually not changing, or it is changing, you might find that asthma levels are raising because we have a way to track asthma or something. Then you have an argument to say, look, we have to change laws governing pollution in the city because people are being affected.
And in what way does your company Razorfish come in?
Razorfish Healthware.
Yeah.
Well, we conceptualize, strategize, and develop new concepts. So we're looking at sensors, we're looking at wearable computing as new areas. I'm personally not involved in that right now, but I think anything that will help improve communication and improve healthcare or communication between healthcare providers and patients is part of what we're trying to do.
To achieve, yeah.
So, and of course, we're working mostly at Razorfish Healthware is working mostly with industries and healthcare industries with patients. Maybe we can work more in the quantified self, whether it's developing new ways to use these tools, or find unique campaigns in which patients can empower themselves. But,
so there will be an interesting future ahead of us.
yeah, of course.
Always. That's too general. But what will be the impact on society?
Yeah, if we're able to visualize our habits in ways we couldn't visualize before, it helps us see the world differently. Like everyone agrees that when during the space exploration, the first time humanity went out into space and was able to see the world as on a single globe, it helped change our perspective and view on humanity, that we're a single unified globe. So maybe through the data that we're collecting, we can start really looking at our health differently, or looking at how some regions may not be as healthy as others. Why is that? Mm-hmm. And then we help encourage or help motivate or persuade or build up those areas.
Yeah.
So I see it as a tool, tracking and big data as a tool to help change policy and then change behavior as well as improve society.
But doesn't it go really slow? Because we know for years that the Mediterranean food diet
is better.
Is much better, and people will grow old and because of that. And
yeah, but there might be other factors involved we don't know.
Yeah.
Maybe in Mediterranean foods in a Mediterranean context together.
So with the sun and
is probably the key.
Yeah.
But if you take, let's say, Mediterranean foods and then
be in the rain all the time.
Yeah, if you live in Iceland or something, which is a beautiful country, but you have longer periods of darkness in the winter, maybe there's aspects that don't change. Maybe there's a different diet that's needed.
But by saying this, it's so complex. Will we ever get the answer?
That's why I think we need to. Of course, we need to start small and focused, and then I think it's like a domino effect. We'll see what happens when you couple data. Let's say social media usage, media consumption, weather with health. You might find that eating a burrito while watching Big Bang Theory, when the weather's like this, you might have a different
you sleep
mental
better
state.
or not?
No, it's endless. In that sense, it's kind of when I was talking.
But isn't it because it's endless? Isn't it also kind of useless? Or do you still think we have to start and we have to get grip? And if you never start, we'll never get grip.
You always find this dilemma in life, I think. We as individuals find value in things that you might not value, I might find value. So there might be aspects or things that I track which are valuable for me, which might not be valuable for you. But it's how you view it. So I guess it's like anything in life, it's how you value it, how you see it, the perspective you have. Yeah. But thank you for this interview. And
thank you very much.
I hope I was able to share something useful. Okay.
Well, sort of philosophical view on the whole thing. Thank you very much.
Thanks. This is you?